Welcome, mayors. My name is Antonio Scott with the African American Mayors Association. Thank you so much for joining us today. During today's session, we will highlight the importance of tackling health disparities that our communities face head on, learning about how the Move with the Mayor program can be used as a resource and technical assistance for AAMA members, and hear firsthand from mayors Deanna Holiday Ingram and Stephen Reed as how Move with the Mayor impacted their community and more about their leadership in promoting health and well-being. Our panelist today is Mayor Deanna Holiday Ingram, the 34th mayor of East Point, Georgia. Mayor Holiday Ingram is a champion public servant, wife, mother, and advocate who is dedicated to public service. Mayor Holiday Ingram's parents reared her to think out of the box and lead change to improve the lives of others. She believes service is the rent we pay for our room here on earth. Next up is Mayor Stephen L. Reed. Mayor Reed is the 57th mayor of the city of Montgomery, Alabama, a historic destination known globally as the birthplace of the Civil Rights Movement. Mayor Reed is the first African American to hold the position. A native of Montgomery, Mayor Reed is committed to realizing his vision of a more equitable, progressive, and compassionate city. To that end, he is advancing an agenda that addresses the community's most pressing issues and puts Montgomery on track to become a leader in the New South. The Move with the Mayor initiative is a program developed by AAMA Business Council members, the National Forum for Heart Disease and Stroke Prevention. Joining Mayors Ingram and Reed are Jen Childress, Director of Programs, and Dr. Warren Jones, a family physician and immediate past board chair of the National Forum. Jen manages the Move with the Mayor program and has over a decade of leadership in both the private and nonprofit sectors, organizing events and convening stakeholders, including recruiting and educating lay leaders, senior leaders, and community champions. Dr. Warren Jones has over 30 years of experience in healthcare. Notably, he founded and established the Mississippi Institute for Improvement of Geographic Minority Health and Health Disparities at the University of Mississippi Medical Center. Dr. Jones's other professional experience includes directing the state of Mississippi's Medicaid program. Over the course of his career, Dr. Jones has been recognized for his pioneering efforts in the field of health, as well as a distinguished educator. He was recognized as Outstanding Minority Educator in the state of Mississippi and was elected the first African-American president of the American Academy of Family Physicians. He was also the first African-American appointed as Associate Vice Chancellor at the University of Mississippi Medical Center. Thank you all for joining us today. I'll turn it over to Jen Childress, Director of Programs with the National Forum.
Thank you so much, Antonio, and we're delighted to be here today. And thank you to AAMA for this opportunity to share the program with members. Slides up, please. So a little bit of background. The Move with the Mayor initiative is a signature program of the National Forum for the Heart Disease and Stroke Prevention. Next. Mayors are using Move with the Mayor to encourage active, healthy living and strengthen individual and community resilience. In its 9th year, mayors are using Move with the Mayor messaging, programming, policy, and infrastructure recommendations and other tools to empower and protect community members from health threats and improve cardiovascular health, mental health, and health equity. Over the past year, 23 AAMA mayors have been engaged across the various arms of Move with the Mayor, including physical activity, adult vaccination, and flu prevention. During today's webinar, we're going to focus on AAMA member mayors' engagement and the impact specifically in the adult vaccination initiative, which was established to help overcome vaccine hesitancy and support the U.S. COVID-19 and influenza vaccination goals. So with support from the CDC and the National Association of Chronic Disease Directors, the National Forum scaled up our Move with the Mayor initiative to leverage the influence of U.S. mayors to increase vaccine receptivity, focusing on priority populations. Our strategy included developing messages and activities tailored to racial, ethnic, and rural populations with chronic medical conditions. We provided mayors with evidence-based information through the production and promotion of short yet impactful public service announcements. Next, please. So looking from a nationwide perspective, our team used data to determine the recruitment reach, focusing on political, racial, and geographic diversity. 123 mayors overall committed to participate in the project. Next. And of those, 88 mayors produced PSAs that were distributed. Next slide, please, which resulted in the following reach. 32 states were represented by participating mayors whose PSAs ran on social media and radio and in local movie theaters, resulting in a total of 134 million plus impressions. A special partnership, which we'll hear about in a little bit, among mayors Haygood, Lumumba, Woodfin, and Reed during last fall's Morehouse Tuskegee Classic resulted in over 1.1 million views. So let's go ahead and dive in with a video highlight reel showing more about this initiative.
In 2022, Move with the Mayor partnered with the African American Mayors Association to protect and improve health in communities across the U.S. With your partnership, we helped raise awareness, provide accurate information, and inspire communities to get vaccinated.
Hello, my name is Dr. Warren Jones. I'm a family physician and immediate past board chair for the National Forum for Heart Disease and Stroke Prevention. The annual Morehouse Tuskegee Football Classic was an event that connected people across not only Alabama and Georgia, but the entire nation. By linking this outstanding rivalry with health awareness, we were able to get this message to over 1.1 million viewers over the course of the football season. This positive message helped to build trust in modern vaccines and support healthy communities.
I'm John Clymer, Executive Director of the National Forum for Heart Disease and Stroke Prevention.
African American Mayors Association mayors came together to make powerful PSAs that were publicized in their cities. The National Forum supported production by collecting videos, creating PSAs, and coordinating media campaigns that aired on YouTube, social media, radio, print, and even in movie theaters. The results? Over 134 million impressions connecting mayors with their residents, inspiring healthier communities. As mayor, you are a trusted messenger in your community, and collaboration between the National Forum and AAMA supports better health outcomes in your city. If you want to learn more about how Move with the Mayor can support your community, contact the National Forum today.
Awesome, thank you. And so now we'll go into the panel and hear directly from Mayors Ingram and Reed. Mayors, you have many different competing priorities on your plate. So why do you choose to place a priority on health within your communities?
Well, I think first, let me start by jumping in and saying thank you for pulling this together. Really appreciate the work you all are doing with the African American Mayors Association, and certainly thank my colleague that's on the call as well. You know, I think it's important for us as mayors to use the platform that we have to connect our community to things that matter, and what's more important than their health. And when we consider many of the challenges that we see across our communities, often health gets overlooked or is not thought about until there's an inflection point. And I think what we're able to do as mayors is to say, these are things that we work on too. We work with our hospitals, we work with our public health departments, we work with other nonprofits and private entities to make sure that from the city side and the community side, we're advocating better life practices, better health practices for each and every person that we represent.
Yeah, I agree with Mayor Reed. You know, it's important for communities of color and for our people who live in our communities. Oftentimes, it seems like being healthy is not accessible or attainable. It's out of our reach. And I think it's important as leaders in our community that we as a government say our health is extremely important, and we're going to intentionally, you know, connect and provide information on resources, on health resources, health programs and services, and also, you know, highlight the importance of adult vaccinations, highlight the importance of, you know, making sure that you have a primary care doctor. Oftentimes people might think that that's outside of government, but we represent people, and if our people aren't healthy, then that's not a good indicator of a thriving community. And as leaders in our community, I think it's when the government says health is important, and when we say these are the things that you can do and this is what I'm doing, we're leading by example. I think it really helps improve outcomes in our communities.
I love that. Partnership, collaboration, leading by example, knowing that you are pillars within the community and encouraging to community members and placing importance. That's so fantastic. What would you say that your partnership with Move with the Mayor, how has that benefited you in your role as a community leader?
You know, I think when this opportunity was presented to me, I found it very interesting and wanted to participate because there was a lot of focus on the COVID-19 vaccination, right? And that is extremely important. But I think this gave us the opportunity to also highlight the importance of other adult vaccinations and making sure that we're staying fully vaccinated and that we're not, creating opportunities where people could either slip their minds or feel like it's only COVID. And so for me, that was a really great opportunity through this partnership to say, hey, yes, it's COVID-19. Hopefully you've been vaxxed and boosted, but also remember, there are these other adult vaccinations that we need to make sure that we are doing on a consistent basis as well.
Absolutely.
Yeah, I agree with Mayor Graham. For us, I think just to be able to talk about other issues has been very helpful for us, whether it's diabetes, whether it's obesity or heart disease, many other things that, impact people each and every day. Having some practice and having that outreach, I think, has allowed our office to stay in touch and to try to, use that, whether it be through city council meetings, neighborhood meetings, as well as social media to get that word out about why it's important to get annual checkups, how you find out about free screenings that you may not know about, and why it's relevant for members of our community to be aware of these type of services because they're being paid for and often they just don't know about it or they may not be able to be connected. So I think making sure that we stay out there on the health front and kind of what we started in COVID-19 has been a value-added service that maybe a lot of mayors prior to may not have really thought much about, and I would understand why.
Awesome answers. I love that. The connectivity, awareness, education, and helping community members get plugged into the resources that are available. Such an important job, and lots of resources are available out there. So why do you feel that's important for community members to see you as mayors leading by example and leading the way when it comes to health and well-being?
Well, I think often, we're the most visible elected official in our communities. And so, you have to lead by example. And I think when people see that we're taking it seriously, when we're making it a priority, it puts it on their radar to consider to do the same thing. And I think it lets them know that we do care, that we're empathetic with things that are happening in our communities. And we want to try to provide outcomes and solutions in that area as well.
I agree. We have a 90-day Healthy Point initiative where we provide free activities. So yoga, Zumba, bounce, box fit, all types of aerobic classes, walking groups, healthy movie nights, because it's not just about your physical. A lot of time we focus on our body and what we eat, but not the mental side of making up your mind to decide that you want to make healthier choices, right? And so those opportunities give us the opportunity to provide multicultural, but also multi-generational activities. So we had chair aerobics, right? We had partnered with an organization that provide classes for people who are blind or disabled, right? So like making it an opportunity for everyone to be able to participate in a 90-day intensive, but it's also year round. Every day we need to strive to be healthy, but that gives an opportunity for people, neighbors to meet neighbors and connect and around this goal of being healthier, right? I say being healthy is not a size, it's a lifestyle. We're not trying to get to a dress size. We're trying to get to a place where we're making healthier choices. And if you drink no water, drink 1 glass a day, drink more water, eat more fruits and vegetables, right? Like starting and respecting where you are as an individual and leading in that way and making that a part of, you know, the work that I prioritize within my administration, I think is important because, you know, we have to walk it like we talk. We can't just say things and be like, go do this and good luck with that, right?
Mhm.
But being able to connect and collaborate and partner and build this real community around health is a great opportunity.
Oh my gosh, that's fantastic. Leading by example, you're right. Highest visibility. Um, it's fitness is not a size, it's a lifestyle. And this is just so cool that you're empowering your community members across age, resources, and capabilities. So that's incredible. Mayor Reed, we saw a little bit of a highlight from the Morehouse Tuskegee Classic. Can you share more with us about your experience in filming with your fellow mayors? And is that something you'd recommend that other mayors do, tag team together and on future initiatives?
Sure, it was a great idea and concept that I didn't come up with, but someone did, and I think it was something that touched a lot of our communities because you had a collaboration of mayors from Montgomery, Alabama, Birmingham, Jackson, Mississippi, and Tuskegee, who were a part of that, all with a vested interest in that football game. But the game was certainly secondary to making sure that we did the PSA and we talked to our community during a time when many are engaged in sporting activities about their health. And I think collaborations like that are unique, but I think they're also a great opportunity for us to leverage the power of persuasion from other colleagues that we have across the country. And I think that many others would see the same, if not a larger impact from doing collaboration, something similar, whether it be through a football game or some other sporting event, or just in general, just to show the shared care that I think we all have for what we want to see for residents that live in our communities.
Awesome. Mayor Ingram, is there anything that you do within your community as a collaboration with other mayors too, like broadly from a health front, or that this sparked any ideas for that beer rodeo or football game or something?
Well, we haven't had as much fun as the Morehouse mayors and Tuskegee around a sporting event, but I will say that, you know, we have a very great partnership with Morehouse School of Medicine and the mayor's alma mater. They received up to a $1.1 million grant to advance health equity in the city of East Point. And so we're in our third year. We've just applied for our third year of funding. We've received $750,000. We're applying for the final 375, and the work has been so amazingly impactful through the support we're getting from Morehouse School of Medicine. So like looking at policies, but also hosting annual health equity summits. And so that partnership is with healthcare providers, resources. Southside Medical Center is owned and operated by Morehouse School of Medicine grad, Dr. David Williams. They bring their mobile clinic there as well as Morehouse, and we just had it recently, right? So this idea of partnering, creating events around health has been our focus in our community. And, you know, soon maybe we'll get one of those fun types of activities of a game or connecting to my HBCU roots at FAMU to also continue to spread this love of health. But definitely appreciate, we wouldn't be able to do the work that we do around health without Morehouse School of Medicine.
That's an amazing partnership, and kudos to you and your community for the grant. That's so exciting and powerful work.
Yeah.
So speaking of partnerships, what do you think it's important for partnerships such as the one between Move with the Mayor and the AAMA members more broadly, and partnerships between AAMA members and business council members?
I think it gives an opportunity for us to have one message, right? And to really be able to impact our country by, you know, connecting with mayors, African-American mayors across the country, to be able to say this is important and we're doing this in 32 states across the country. We're all on the same page. We all feel like this is important, and we're all, you know, encouraging our community and supporting our community and building these networks. I think it's critically important, and I think that shows the value of the business council, AAMA's business council, because being able to really bring all of that together to impact people, right? It's one thing to have impressive things, but when we actually start, partnering on things that are getting directly to the people in our community and helping them and improving their quality of life, I think that is much more impactful, and it helps us build our coalition as mayors and the impact and the force that we have together.
Awesome. Mayor Reed.
I agree. I think from my standpoint, exactly what Mayor Ingram just said. I think, collaborations like this are, very important for us to continue partnerships from an organizational standpoint, as well as from the standpoint of us as individual mayors in our communities. I think it helps elevate the conversation around different health initiatives. And I think it shows, again, that as mayor, we're balancing different, we're trying to balance, different balls in the air, if you will, when you're looking at the health and the wealth of your community. They're inextricably tied. And when you have a healthy community, you have a community that's more attractive for growth. You have a community that's more attractive to those that live there. And you have a community that really has a lot of opportunity versus one that does not. And, for us to have these type of partnerships as AAMA members, AAMA mayor members, I think is very important. And I would like to see us do more of these along the way.
Awesome. I love this unified message, power in numbers, that cohesive, 32 states working together, and then health and wealth being inextricably linked. We've got so many amazing nuggets coming out of this. And like, speaking of partnerships and jumping off from Mayor Ingram, you mentioned the tie-in with Morehouse School of Medicine. Dr. Jones, what views and advice do you have in terms of impact that Move With the Mayor can have in a community when mayors are partnered with trusted leaders such as clinicians?
Well, thank you very much for the chance to be here this morning. And Mayor Reed, good to see you again. I enjoyed being with you over in Birmingham. Mayor Ingram, I apologize, I haven't had the chance to meet you yet. I'm surprised you're here today. I presume you're flying to Miami on Saturday to be at the big game. You're not going to the game. Bless you.
Nah, not this time. They just had a deluge there. My brother texted me this morning. He was like, I'm in Miami for the Orange Blossom Class. I'm like, what about the hurricane? He was like, oh yeah, that was a couple hours. So yeah, I'm still at home, but I live vicariously through my brother.
Oh, I love it. I love it. I love it. Well, needless to say, half of Jackson, Mississippi is flying down there. I think you know that. But it's important to hear the messages that you share today. What a lot of people don't understand is that as mayors, you and AAMA members, you own the bully pulpits in your community. People hang on what you say and they value the guidance you give them. And that's one of the roles that we can play with you as physicians and clinicians and other healthcare providers. We can be that trusted partner with you to help to get the message out. I'm so glad to hear about you working with Dr. Montgomery Rice at Morehouse and her team to do the things that you're doing for East Point. I love visiting East Point when I'm in the area. And so I know that the health of your community is very, very important to you. It helps also that they've got a program that's focused on immunizations among adults and the whole family. So you've got not only the work that they're doing with you for your community, but you've got the work that parallels what we're doing with Walking with the Mayor. A lot of times folks think that they understand that walking is exercise and it does good things for you, and it does. The important thing is it not only adds years to your life, but it adds life to your years. So that when you're moving more, you're healthier and you can do more. I love the fact that I've seen the videos and watched you guys doing what you do. You're also young and energetic, and an old man like me feels comfortable, feels really wonderful to talk to you guys. But to know that these things are out there. Here's something else that I hope that the members of your community know. When they get a flu shot, it actually protects them or helps to protect them against heart disease, okay, and hospitalization. It's cardioprotective, so it's a benefit there. So I would really urge you that challenge the docs and the nurses in your community to get out there and do things with you. Get them to go into the schools and have the kids go home to their parents and say, come on, mom and dad, let's walk together. You know, it's interesting. One of the reasons why C. Everett Koop was able to make a difference with smoking was he went to second graders and he said to second graders, go home and tell your mom and dad not to smoke. And they went home and put pressure on their moms and dads not to smoke. And that's one of the reasons they stopped. So maybe one of the things we can do, in addition to your using Move with the Mayor to get things to happen, we can empower families to get messages throughout the pipeline. Lastly, I'll say that influenza and other diseases for which we've got vaccinations, they have a very, very major toll on our communities. And there's a community that there's an organization that's based not far away from you called the Association of Black Cardiologists. And their tagline is that children should know their grandparents. And one of the things that we can do in our communities by Move with the Mayor and other activities, have that multi-generational support and interaction that children can know their grandparents. I can tell you we face challenges. I lost my oldest daughter at 46 from heart disease. Okay. Families experience this kind of challenge. And Move with the Mayor and immunization and vaccination, and these are things that we can do as families to help to make sure that we have each other longitudinally and can make a difference. And I just salute you for what you do, the way you do it, the passion you bring to the table. And I wish I could emulate that in the way I function. So thank you for all you do. Yeah.
Awesome. And I know Mayor Reed has to hop. So one final question. We'll go to Mayor Reed first and then Mayor Ingram. What recommendations do you have for other mayors and how they can address the health of their communities, or where to even start?
Well, I think, the first thing is to make sure they're in touch with their health providers overall, from insurance companies to the nonprofits, to the hospitals, obviously, to their public health department. I think second, from there, they will find out where some opportunities may lie in terms of connectivity to make sure that people are really getting the message and people really understand the services. One thing that I did when I came in on my transition team, I had a public health committee. And I mean, we learned so much far beyond what we thought we knew about where the gaps were, where the challenges were, and where there were some opportunities from those in that space who really, really want to assist. And then, you look out and you try to figure out what are some things that are working in other communities. I think the thing that we like to say as mayors is, we like to borrow one another's good ideas. And so that is a Rumba, a Zoom, what did you say, Emmanuel? A Rumba class and some of those things that they're doing in East Point, then that's a great idea. If it's a Move Montgomery that we do here, in our city, that's great. You don't have to reinvent the wheel. And I think that what they'll find is that there's a lot of interest from the healthcare providers and healthcare partners, and that the community will respond. You'd be surprised at how many people come out for these events. And so it's just a great opportunity, but you don't have to, come up with the concept yourself. I think there are enough blueprints out there that are working to try and see which one fits their respective communities.
Yeah, I totally agree with Maris, the Zumba class, but along the lines of not reinventing the wheel, former AAMA mayor Oliver Gilbert, who's was the mayor of Miami Gardens, he and I went to FAMU together. So when I was a council member, I had Walk the Point, right? So just meet me at one of the 4 parks in the community. Like I picked a different route, but that was a way for me to go around the city and for people to meet me and for us to do something healthy, right? Start with something small, like make sure that health is a priority and people know that health is a priority for you as mayor, but not reinventing the wheel. I literally got the healthy point from Mayor Gilbert's, former Mayor Gilbert's fitness challenge in Miami Gardens. Like literally looked at it, called them, hey, like, how do you do this? And then started it here in East Point. And we're now 5 years later, and it's evolved over time, right? We have more classes and things. Now people earn incentives. So it's not like the first year we made the mistake and gave out activity trackers to everybody who registered. Well, we didn't really see them anymore at any of the other activities. So now you earn as you go, right? One activity for 6 weeks, you get a insulated Healthy Point tote bag, lunch bag. You do 2 activities for 8 weeks, you get a signature gym bag. You do 10 weeks, 3 activities, you get a Yeti, a signature Yeti, and people really love the Yeti. And then 12 weeks and 3 times a week, you get a $200 gift card, recognition at a council meeting, and a healthy dinners catered by a celebrity chef or our culinary team, right? And this year we had 12 people earn. It was multi-generational. So I had people in their 60s, and I had my first youth earn the top incentive. He's in the 6th grade. So he and his mom did it together, right? But like, this is a 90-day period that we do kind of in the spring, March through like June, but it has grown, right? And it's what I would say and recommend, just start, do something, make it important. If you have a park and recreation program, the mayor showing up at a class, right, says that this is important. You don't even have to do anything to coordinate it yourself. Like, take small steps, but make sure you at least take a step, because in our community, as Mary Reed said, our health is our wealth. And if we are not making it accessible, attainable, and fun, like demystifying this fact that, you know, if being healthy is for them, like, no, it's for everyone. And we added a mental health component this year as well, because usually when we talk about mental, it's mental illness, it's being sick. We never talk about mental health. Like, we have the right to have a healthy mind, and demystifying that whole approach to mental health, to make sure that as a community and as mayors, we're saying, like, mental health, we have the right to be healthy mentally. And then just like with any other ailment, hypertension, diabetes, if there's some time where you need to go get a checkup or go talk to someone, that's okay too, right?
Yes.
Because we have to deal with and demystify and destigmatize all of these things that have gone on for generations in our community, to make people like not be as receptive to healthcare services or as preventive, right? And then the other thing is, and Mary Reed mentioned connecting with public health and healthcare providers. Federally qualified health centers get funding from the federal government to treat uninsured people. And so if you have one in your community, the majority of people that were showing up at the emergency center that was in our city needed primary care. They need to be connected to a primary care home. And federally qualified health centers are a key piece to that. And so we work with Southside Medical Center in our community, but making sure that we start getting people going to the doctor and connecting with a primary health care home, so they're not showing up at ER in places where the health cost is much more expensive for non-emergency situations, right? And so, I mean, there's a lot of work that we can do, but I would recommend, like, start small, do something, do not reinvent the wheel. There are a number of different things that mayors all across this country have done that you can tap into, but also make sure that you make the statement, right? Make the statement and take action to show why health is important and that doing something to help improve outcomes.
Jen,
Amazing advice and feedback.
yeah,
Go for it, Dr. Jones.
yeah, Mayor Holiday Ingram, I love that. I want that snippet so that I can take it around the country with me, okay? That's how you own your community's health and healthful living. You think proactively, you bring in all of the partners to the table, you accept the ideas of the young and you welcome the old. That's how you do it. And I just salute you for having that energy. It's important that we think that way. For so many years, underserved minorities had barriers to being able to do things. I ran a state agency here in Mississippi, and much of my workforce were people of color. And I used to close down Friday for lunch once a month. And we would walk, it was called it was called Medicaid in Motion. And all of my offices, all 23 would close, and for that hour we would walk. Know that people complained and I was forced to stop that. Okay. they didn't understand the value of those kind of things to the community. I'm so happy to hear the success that you're having and that AAMA mayors are having. And with Move with the Mayor, we look forward to working hand in hand with you to continue that success. I'm sorry, Jen, I just had to share that.
Yeah, this is so exciting. And Mayors Reed and Ingram, like hearing from you about just starting, moving in that, you'll if you build it, they will come. People are interested and really, people enjoy knowing that you actually care and are taking action. So that's so inspiring and encouraging. Thank you for your leadership. I'm just going to open the floor now for any additional questions. And if there's anything, Dr. Jones, that you would like to ask, and we can wrap up.
Yeah, no, I would just like to ask you, Mayor Holliday Ingram, are you able to find individual champions in your community, physician champions, nurse champions, to help to administer some of those programs? Or does everyone come back to you to make sure that you're the spark plug to keep things going? Because there's only so much of you to go around. Okay.
Yeah, that's a great question. We have been at this work for quite some time. Our equity work, right? Dismantling systemic inequities and disparities in our community. And we're not lulled to believe that because we're a community that's majority people of color, and the majority of people in our council are people of color. Actually, all of us. Right now, first time in the city's history, all 8 council members and the mayor are African American. But we know that doesn't mean we don't have disparities or inequities within our community, and we've been committed to doing it, work around it intentionally. And I think so what's happened is we have built strong partnerships and collaboration with people in our community. And so, yes, whenever any one of my healthcare partners asks me to be somewhere, I'm there because I prioritize this. I try not to intentionally be hypocritical. I can't say one thing and do another. So I absolutely show up. But what we're doing is building a system. I think oftentimes we expect people who are experiencing trauma or life challenges to figure out what we who are not at the time experiencing haven't figured out, right? And so we want to ensure through this work with Morehouse School of Medicine and our Advancing Health Equity and East Point grant, and through all of the many partnerships that we're building, that we do government, right? That's our role.
Yes.
But I need subject matter experts in all different areas. So I have people that I go to, and I know just enough to be able to raise an issue. But when we want details, I'm definitely going to have some of my trusted partners in the room. And then also marketing the services that they provide so that people know what's available in our community. A lot of times people drive outside of the community to get what they could get inside the community. Now, if that's a quality issue, we definitely need to make sure there's high quality comprehensive care within our community, right? And so we have to hold people accountable, but it's really doing all of the work together. And yes, stay in touch with them. I often have several of them in my cell phone, and like literally I got an email about something about a health, wanting a letter of support about health. I send it over to Morehouse School of Medicine. Can you look into this? Like, is this something I should be doing? Do you know anything about it? Because there are a lot of things that we manage or are responsible for as mayors, a lot of different, departments, or like we have our own power company, we have our own water company. There's a lot of different things. And so I'm not crazy enough to think that I'm a master in any of those things, but I have a lot of subject matter experts in the healthcare industry that I lean on heavily, and they know that they can count on me and that I can definitely count on them.
And my last question for you, are you getting much support from the Divine Nine in your community, and they're stepping out to assist you with your motion and your health focus and things of that nature?
Yeah, so I am a member of Delta Sigma Theta Sorority Incorporated and a member of the East Point College Park Alumni Chapter, the best chapter in the whole wide world. And so we definitely lean into the Divine Nine, Zetas, AKAs, like literally Qs, Omega, all Alphas, Kappas, like everyone is supportive of the work that we do within our community. And so, when we had our COVID-19 vaccination drives. We partner with 100 Black men of South Metro, right? Like extending beyond the Divine Nine, but to other organizations that are within the community that help support the community. And so there's a lot of support, right? The challenge is not doing so many things that you don't have impact. And getting everyone on the same page around what's important, and then connecting into that. I don't believe in duplicating things. I believe in supporting what already exists. If it's high quality, if it's serving the community, like I love to just show up and support. It's less work, but it's also more impactful, right?
Yes.
Because then you get trusted partners, you build your network, and you build the resources and the impact that you can have on your residents. And so we get a lot of support from a number of different organizations. The goal, they look to us to kind of be the convener, the connector, and also the action plan builder, right? Like, what are we going to do about this? And not that government is going to do it directly, but the ability to convene, the ability to use our platform, our pulpit, to create awareness or heighten awareness around issues is so important. And when bringing those things to the table, we have buildings, like we'll provide a building for different things, right? Providing venues within the community to then bring in those resources. And that has been what's been very helpful.
And there was a question in the chat and it points to something that you spoke about earlier about how being physically active and walking can impact your mental awareness and your mental stability. To hear you talk about that made a great, was really important. And I was wondering if there's anything that you wanted to share about your observations of how the physical health improves the members of your community's mental health and their ability to deal with challenges.
Yeah, I think that's a great question. And again, this is the first year where we intentionally had mental health class, a monthly class or session, be a part of the Healthy Point Initiative, right? Like the idea of being intentional about making those connections is something that we've just recently started, but it's so important. So when it was brought to my attention, I was like, yes, like, why not? And why won't we will continue to have those monthly, right, throughout the year, because that's important. We have an amazing person in our community who is a doctor, psychiatrist. I mean, she's so great at the way she does the work and how she communicates it. And at our Health Equity Summit, one of the strategies she shared was the physical part and how physical is connected to mental. But I'll just be honest, we're just starting to make that connection, but I think it's an important connection. And when we talk about health, that we talk about it holistically. It's easy when you're focused on the dress size to focus on like, what exercise are you doing and what food are you eating, right? But until you make up your mind that I want to be healthier, that I'm going to make healthier choices, and it's not 100% game, it's just healthier, like better, right? Like doing, progressing, and making that accessible, attainable, and fun, and giving people permission to like not beat yourself up. Like, I tell people I'm a flexitarian. I was so excited when I found that word and looked it up. I'm like, because some weeks I might be vegan or I might not be eating meat, but today I might want a pork chop. I don't eat them every day. They don't come in my house, but if I'm at a soul food restaurant and I want a pork chop, I'm going to eat it, right? And I'm not going to feel guilty about it. I'm going to enjoy it. But like, because when we think about it, think about the barriers. You mentioned barriers earlier. Think about the barriers that we put up for people.
Yes.
Right? Like, you go to the doctor and they're like, don't drink only water. Don't drink no sweets or anything. Don't eat anything white. Don't do this, don't do that. And you just went to the grocery store before going to the doctor and bought all that stuff. You already feel defeated. Right? It's like, oh my God. No, we're like, start where you are. I don't even need to know how many glasses of water you drink. Just drink more. I don't even need to know how much fruits and vegetables you eat. Just eat more. Right? So, and then have cheat days, have cheat days. So yeah, I think we have to like stop putting up barriers for people.
Yes. To members of our team, there's something that the mayor said a few times about being intentional. If you're not intentional about what your objective is, the opportunity for success will not be there. And there's so many barriers that it takes that intentionality to find a way to circumvent. I'm just energized by meeting you, and I can't wait to meet you in person. And thank you
Absolutely.
for the opportunity to be a part of this panel today.
Well, there's no point like East Point. So the next time you come through, you have to like make
I
sure we
will.
connect.
Thank you.
Thank you so much, Mayor Ingram. I love that you said it a couple of times, accessible, attainable, fun. I think that's such a great motto and something for us in terms of intentionality to underscore that point, and that everything's inextricably linked from health and well-being. So thank you so much for sharing your time and energy with us today. I'll go ahead and turn it over to Antonio.
Thank you so much. Before we wrap up today, just wanted to check and see if we had any last questions from the audience before we ended today's webinar. Alrighty. Well, look, seeing none, it has been a great conversation today. What an insightful conversation. We want to thank so much to our panelists, Mayor Deanna Holiday Ingram of East Point, Georgia, Mayor Stephen Reed, who had to hop off a little bit earlier, of Montgomery, Alabama, and Dr. Warren Jones. A special thank you to Joan Childress of the National Forum for moderating today's discussion. And what a great discussion it was. We've recorded today's discussion, and we'll make sure to make it available online to you. And then links to the video for the Move with the Mayor program will be made available in the chat. And then, of course, mayors, if you have any questions, feel free to reach out to AAMA staff. We'll be more than happy to connect you to those resources. Before we dismiss today, again, I just want to give a big thank you and shout out to our partners, the National Forum, the Executive Director, Mr. John Clymer. Thank you for joining us today. It has been an absolute pleasure working with you all, and we look forward to continuing to expand health initiatives in our cities and in our communities. So thank you for your partnership. We look forward to working with you again in the future. And thanks everyone for joining today's webinar.
Thank you.
Thank you so much for the opportunity. Take care.
Take care.